Hello to everyone. We're here today to explain some of the oxygen delivery devices for our healthcare professionals, including nursing. We're going to go through our lesson plan, and some things we touched on were the common delivery devices and some of them that involve specific FiO2s for our purposes and our patients. First, I'm going to start off with the most basic that I'm pretty sure we're all familiar with, is the nasal cannula. This is a great device to deliver any oxygen flows from 0 to 6. After 6, it's really not adequate. There's too much resistance in this tubing, and we want to definitely switch to a different device once it does exceed 6. You can use this off the wall, which is in the hospital, 50 psi. At the moment, I'm in a home care setting facility, so I'm going to show and demonstrate on a oxygen concentrator, which is how we deliver our oxygen to our patients in the home. Oxygen concentrators have the capabilities to deliver anywhere from 0 to 20 liters per minute. We can wire machines together and get very creative. So it's a wonderful thing for nurses to realize patients coming out of the hospital into the home, we can definitely handle all their needs. So the nasal cannula, the prongs, want to roll into the nose, down the nasal passageway, so we follow that specifically for airflow. Place them in the nose and then up around the ears. There's a little sliding device here for security. Then one end of the device would have to go to our oxygen concentrator, which is down here on the floor. I'm going to apply power, and we're going to hear the system alarm to go off. We apply the cannula here, and our dial flow variance is right here. It's a Thorpe tube ball, and you want to split the ball right with the line, just like we do in the hospital setting. Right now I'm on 2 liters per minute. Sieve beds inside the concentrator will pump air in and out, taking room air, removing the nitrogen, and producing the concentrated oxygen. So this is a great way to deliver our basic O2 needs for patients with pulmonary problems. So with that said, I'm going to go ahead and shut this down and show another need or a way capability to provide oxygen, which would be from a standard compressed gas tank. This is an E-tank with a regulator. The regulator, as we all know, is a pin index system. This will come off and on with the pin index system here, which allows us to have the good seal for the tank with the 2,000 pounds of pressure, which is what is in a tank. It's compressed gas. We put our regulator on like such, tighten the regulator, use our E-wrench on top of the unit to open the tank, which is going to show us our amount of oxygen by our gauge. And then this device will plug in here and turn your dial flow here as needed for oxygen, all the way up to 6 with this nasal cannula. Okay, with that said, I'm going to go ahead and shut this down. So this is our portable needs for our patient, and we have our home needs for our patient. The concentrator is used for everyday use, 24/7 off electricity, and these tanks allow our patients to become portable. So removing that, I'm going to go ahead and take off this nasal cannula, which is a standard cannula. Other delivery devices that we have to use, similar to the nasal cannula. This is a pediatric patient cannula. You're only allowed to use flows, they say, or recommend up to 4. Really after that, again, there's too much resistance in the cannula because the prongs are so small, obviously for our smaller patients. So this is a pediatric cannula. Next we have, kind of in the opposite direction, this is a high flow nasal cannula. It is very much rigid, more rigid in structure. The prongs are themselves a lot larger, and this has capabilities to give flows up to 15 liters per minute. So for in the hospital needs, patients that cannot tolerate a mask, this is definitely a great option. And then on the other hand, patients that cannot handle a mask, or would rather a mask, I should say. This is a simple mask. There's an oxygen adapter here. This simple mask is a low flow delivery device, which needs more than 4 liters per minute to be able to make sure our patients are not trapping the carbon dioxide inside this mask when they breathe. So if there's not adequate flow generated or flow coming through the device, the carbon dioxide needs to be pushed out of these holes. So you really want to make sure patients aren't having these on with any liter flow less than 4. And a lot of these is probably our most involved oxygen delivery device. And again, this is one of our home care devices, but we all know these as the Venturi masks that have a specific Fi2 oxygen capability to dial in with flow. So we can have anywhere from 24% to 50%, just depending on our pivoting of our air entrainment. So just turning this dial, you actually, this is called the percent lock, so you pull out and twist, and you turn to the dial that's specific to our patients. Say I wanted 35%, I would make sure it was right there. You always want to make sure you have your adapter attached, so patients when they roll around in bed are not covering the air entrainment port. Once that's altered, then obviously we wouldn't be getting enough oxygen and the percent would be compromised. So you always want to make sure that's there. Nurses and respiratory therapists, all of us, you know, that's the most important part of this delivery device. And then we'd have our O2 tubing that would attach to the bottom of our oxygen delivery device and then back to the source of oxygen. So covering these basic delivery needs for our patients, they're all for oxygen specifically. And other than making sure our patients are safe and the oxygen is not near an electrical outlet or you know, obviously fire, we try to keep everything very basic and common so it's safe for our patients. We appreciate your time, and if there's any other questions, we'll answer those in our lesson plan and our other content. Have a great day.